palliative medicine specialist. And through the course of the next several minutes, we'll kind of understand and define what it means. But my hope today is to be able to have you all understand what supportive care in cancer means, and how you all to be able to ask for our services, to understand who we are, what we do. So without having to depend on a clinician to consult us, you could bring about the subject of, hey, could I possibly see a palliative care medicine or could I consult with supportive care specialist? So supportive care, defined as healthcare, a specialized type of healthcare given to prevent, reduce, and relieve suffering, and to overall improve the quality of life. Through this morning, the better part of this morning, you've heard from all of the experts how to deal with the cancer. The focus has been the cancer. So the later part, currently this afternoon, what we're going to be talking about is how best to live. How is the individual going to live with the cancer that they have? So the focus shifts from the disease to a person living with the disease. So again, treatments and all of that. A person going through cancer, an individual going through cancer has several needs. Some of the needs are cancer-related needs, right? Treatment-related needs. What do I do with the cancer? How do I quell? How do I, cure, life-prolonging, all of those. But it's equally important for us to be able to journey the cancer continuum, feeling good, feeling the best we can, and trying to manage some of the associated symptoms, whether the symptoms are from the treatment, the symptoms are from the tumor, how best to manage and continue putting your best foot forward through your cancer journey. So an analogy, if I may, picture says a lot of things. So think of you as a bridge. When the bridge is strong, when the bridge is capable, you're able to withstand a lot of traffic, a lot of things on it, a truck, a car, a train. The bridge is basically strong. So you're strong, you're able to withstand a lot of things. Let's say you are diagnosed with a serious illness, such as stomach cancer or any kind of cancer. There potentially could be certain breaks in the bridge, weaknesses in the bridge. The bridge could falter. The same load that you had been able to tolerate when you were strong, you may not be able to do so well with some of the implications related to the serious illness. And this leads to the bridge faltering, and you might struggle with being able to keep up with some of the load that is going on the bridge. That includes the load of treatment. That's where palliative care comes in. Palliative care, the word palliate essentially means palliare, which is Latin, which essentially says to cloak, to cover, to support. So that's essentially what palliative care is. Palliative care, supportive care, best supportive care, you sometimes hear people use it interchangeably. So there needs to be no fear with the word, the terminology palliative care. So understand sometimes they're all used interchangeably. Essentially what palliative care or supportive care does is to build reinforcement to this bridge, which is going through some structural difficulties, cannot hold the workload. So essentially builds reinforcement to support the bridge so a person can still continue with the load on the bridge. So palliative care essentially provides support to the bridge while the bridge continues to be able to handle some of the workload which it faces. So, like I said, it's interchangeable. We use it, supportive care, palliative care, best supportive care often mean the same. It's, again, care delivered by specialists who specializes in delivering such care. And the ultimate goal is to support you through your cancer treatment and help with improving overall quality and the best life possible given the situation. So similar to construction, palliative care is not, it's a team effort. It's not solo. So all of the speakers that you have this afternoon, several of them, the collective team is a supportive care team. It's usually the center focus is the patient and the family as a unit. It's the physician, be it a palliative care specialist, a psychiatrist, a psychologist, a nurse specialist, a clinical pharmacist, a chaplain, a social worker, integrative medicine. So there are several components of a team effort in supportive care, all of which collectively come together essentially to build upon the patient's quality. So again, earlier I had an interesting conversation as to who deserves this. So here I am actually telling you any person, any age, any stage of cancer can benefit from palliative care, or at least a conversation with your oncologist about palliative care. It is alongside curative treatment. The other thing I want to dispel any fears or notion is that palliative care is brought on at a much later stage. What I want to say is palliative care starts at the time of diagnosis. It starts with the conversation about how you're dealing with this, what your hopes are, what your beliefs are, what your values are, what do you intend with the treatment? Do you understand the treatment? So the, communication is a big component of what we do. In addition to, treating some of the symptoms that you invariably might have to face going through some of these treatments. So whether the symptoms are related to the tumor, whether the symptoms are related to the treatment, whether it's just emotional symptoms. I heard Pam earlier speak about how, I'm sorry for pulling up your name, how, draining it was, how emotionally stressful it was. So yes, so all of those understanding that all of us need some support. Like you said, it's a village not just personally, it is also a village within the medical community. So you seek upon the help that is available and continue with the treatment in tandem with the support of a palliative care or a supportive care physician. So again, some of the symptoms, and again, I always say, always working together. We always work together with your medical oncologists, surgical oncologists, radiation oncologists to make sure that you're able to go through the cancer journey the best way possible. So, the key in terms of palliative care, one of the key things that we tend to focus on is symptom management, be it pain control, be it poor appetite, lack of appetite, nutrition. I know we heard about nutrition, diarrhea, constipation, psychosocial support, whether it's mood disorders, whether it's just coping with the disease, how best to cope. We all, I think, at some point need to speak to a psychologist or a counselor because we are better people in terms of the way we think when we do speak to them. They have a different perspective of looking at the same thing. They look at the same exact thing, have a different way of looking at it, rather than the more concrete way some of us look at things. So these are all some of the things that can be done by a supportive care physician. Again, the focus, I just have one slide about cancer pain, mainly because there are lots of myths and fears about cancer pain. Cancer pain is it's commonly experienced in patients who are undergoing treatment at some point. If you look at studies, they say about 80+% have pain at some point during their cancer journey. So speaking about it, not fearing or backing away from talking about it, thinking that if you talk about the pain, the focus shifts from the oncologist talking about your chemotherapy or your treatment away, so that there should be no such fear of shifting focus. So that's where we come in. We could take the focus of discussing a care plan for addressing pain. Again, pain is regularly assessed. The amount of pain doesn't necessarily correlate to the growth of cancer. There are medications available, range of medications, doesn't all have to be opioids. There are range of medications available at every stage of disease. And the medications that you may need at point 1 may not be the same that you need at point 2. So meaning there is a fluctuating course of what you need. You need what you need when you need it, and when you don't need it. So there should be no fear of accepting some of the medications available. And to enforce this, most ASCO, which is one of the oncology organizations, and the American Pain Society, etc., have noted that access to opioids should be available. Opioids should be available as an option for every cancer patient. Doesn't mean that everybody needs it, but that should be an option. So there should be no fear about possibly needing it when you need it. So we've talked about, the importance of palliative care. Up until recently, we all knew it was best practice. It sounded good. It is an added layer of support, and who wouldn't need an added layer of support? But recently, Mass General published actually an article in 2010, not so recent, but nevertheless recently, it published in 2010, wherein they looked, in this particular article and study, they looked at standard care, standard oncological practice, versus adding palliative care early on at the time of diagnosis. So every patient who got diagnosed with metastatic non-small cell cancer, I understand this is not the group, but again, it's cancer, metastatic non-small cell lung cancer. They had the standard way of doing things, and they had the intervention arm, which is basically standard plus early palliative care, having a palliative care physician see the patient automatically. Interestingly, what they found is those patients who had a palliative care consultant right at the outset, integrated as part of normal care or standard of care, there were improvements in quality of life, mood, there were improvements in overall quality of life, tolerability of some of the treatments. And they also interestingly found that those who received palliative care lived slightly longer compared to those who received standard oncological care. So they wanted to prove that this is the case consistently. So they repeated the study. This time they used not just lung cancer patients, they also used GI malignancy. They added stomach cancer, non-colorectal GI malignancy patients, and they were able to replicate similar data in terms of overall improvement of mood, the sense of improved quality, overall decreased anxiety through the treatment, and definitely improvement in life lived, slight prolonged survival. So given the importance, supportive care in oncology is now recognized as an essential component of quality cancer care, which is endorsed by all of the major organizations, whether it's the NCCN, the ASCO, the Oncological Nursing Society, to name some of the few. So some of the resources, in addition to the resources that you could find on the NCCN and the DDF, getpalliativecare.org is an amazing resource for patients who want to know a little bit more about palliative care. So I will stop here, and I purposely ended a little early to see if you had any questions for me.